Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Michelle Carter and I'm joined today by team members from our Food RX program to discuss how food connects us, which is the theme for National Nutrition Month this March. We're joined by Angela Roberson, a registered dietitian who is the regional clinical manager and a diabetes care and education specialist at the Food RX program at MedStar Good Samaritan Hospital. We also have Akinwale Akinsanya, a community health advocate for Food RX. And finally, we're joined by Ashley Lewis, a registered dietitian who leads our Food RX program at MedStar Harbor Hospital. Thanks for joining and welcome to all of you. Today, we're going to talk about the connection we all have with food and how it brings back memories, how it gathers family and friends together, how it nourishes us, and how cultural foods can bring new flavors to old dishes. We will also talk about how to shop and eat well on a budget and how to make a healthy smoothie using fresh and cultural ingredients. Plus, we'll learn more about the Food RX program that has expanded into 3 MedStar Health hospitals in the Baltimore region. So if you or someone you know would like to learn more about eating healthy on a budget and how to spice it up a bit with new flavors, stay with us, stick around, share this broadcast with your friends on social and ask us any questions related to this in the comments below. All right, so I have some questions for Angela and Wale. First, Angela, could you tell us a little bit more about this year's Nutrition Month theme, Food Connects Us?
Yes, absolutely. So this year's 2025 theme from the Academy of Nutrition and Dietetics is Food Connects Us. And I think it's very appropriate, particularly now as we are discussing food as medicine more broadly, that we have to acknowledge that not everyone eats the same thing. We all eat, but not all of our diets are the same, and that's a good thing. So Food Connects Us. The message that the Academy is sending is that everyone enjoys food, but it's not all the same, but we all eat and that we have that connection and sharing different meals, different tastes, different spices, and just communing together as friends and family really does connect us and can deepen the connection when we do so over food.
That's amazing. Also, Angela, as a registered dietitian, how do you incorporate this concept of connection when you're consulting your patients?
Right. So just like there are, many foods across the world, patients are also different. No two patients are the same. And Food RX is really a program that meets every patient where they are and individualizes the plan of care. So if we're going to do that, I need to be able to have a respect for that particular patient's cultural identity. So whether it's Hispanic or West African or Caribbean or, Polish, having a level of understanding of those cultural foods so that when we talk food, which we often do, that the patient feels that I can relate, right? If I have a patient who's coming in and they're talking about how they love soul food and how they prepare perhaps their collard greens or kale or cabbage, just having an awareness and an understanding of that preparation method and the importance to them allows me to, again, tailor my produce prescription, my meal prescription specifically to them.
I love that idea. I like the idea of thinking of it as a food prescription and also incorporating their culture, their identity, all of that, because that's important. Exactly. Turning over to Wale, tell us a little bit about your cultural background and what it means to you.
Yes, so I was born to immigrant parents, both Nigerian, but I was born and raised here in the United States. And a lot of times with first generation families in the States, it's easy for a lot of cultural concepts to get lost. So that's why culture is very important to me. It's what you eat, it's the music you listen to, it's your religion, it's the language you speak. I hold that close to parenting.
Absolutely. And Wale, what foods connect you back to Nigeria and to your family in those special moments that you share with your family?
It's a lot of foods. It's a lot. But for me personally, I'm a big fan of jollof rice, pounded yam, um, the goosey soup, F-all soup, all the soups.
What's in a goosey? Oh, what do you say it again?
That goosey.
And what's in it?
That goosey soup is made from like lemon seeds. Has peppers in it too. You usually eat it with our hand foods like fufu or eba or eba. It's a lot. So it consists of mango seeds, mashed up peppers,
And
and
fufu is more of a
it's a pounded.
pounded yam.
That's correct.
It kind of forms into a dough, kind of a ball.
A doughy type of consistency.
And you use it almost like a utensil.
Our hand is the utensil.
Exactly.
So you'll take a piece of the fufu and you'll dip it into the stew, stew of choice, and then you'll just eat it like that.
Okay.
Very delicious. There's a whole bunch of foods. Whole bunch of foods. I'm going for days.
Oh, it's lunchtime now. It's making me hungry. I especially love jollof rice. It's one of my favorites as far as Nigerian cuisine.
A lot of times, patients sometimes feel, depending upon whatever their health condition may be, that perhaps they think they can no longer partake of the foods that they really enjoy. And we don't want to take the joy of food away from patients. So this is why it's really important for dietitians to really understand cultural foods and to understand how important it is, just in their happiness, just in a connection to where they're from. So food is equal. All food is equal. There's no food that's better than the other food. And in this program, we help people learn how to continue to eat the foods that they enjoy, but with some perhaps modification so that it promotes better health.
That's a very key point. And I like the fact that you don't have to totally cut out some of those favorite dishes of yours. Yes. Wale, before we turn over to Ashley, could you share some of your favorite fruits and vegetables?
Some of my favorite fruits and vegetables. Me personally, I enjoy eating mangoes, grapefruits. I know everybody don't like grapefruits. Those are like some of my favorite fruits. Vegetables, I'm a big fan of asparagus, spinach, and broccoli.
Good selection there. Nice variety. What about you, Angela?
And high in nutrients, right? So we've got mangoes high in vitamin C, vitamin A, spinach, and asparagus, vitamin K, potassium. These are nutrients that we should be all getting daily. So again, no bad foods.
I like that. Thank you both. Now I want to turn to Ashley. Ashley, we've started to talk about the different kinds of fruits and vegetables. Are fresh fruits and vegetables always the best to purchase? What are some other options if fresh produce isn't available to you?
Hello. So as they mentioned, culture plays a major role in what we eat. And so does affordability, accessibility, and other lifestyle factors. So actually canned and frozen produce can be great options. For one, they have a much longer shelf life over fresh. They're very convenient as well. So not everyone has or wants to or has the lifestyle or means to prepare everything from scratch. And canned and frozen can also be a lifesaver for those with fine or limited fine motor skills. Canned foods are also more accessible than fresh produce. In some environments, people have limited access to fresh produce in grocery stores, so canned options are great. And they don't require refrigeration or freezers, so it's great for emergencies or, again, if you have limited access to those resources. And then when you're choosing canned produce, you want to look for low sodium or no salt added. You can review the nutrition facts panel and look for under 230 milligrams of sodium or under 10% of the daily value as a rule of thumb. You can also drain and rinse the produce that's canned to remove about a third of the sodium. And when you're looking for canned fruits, you want to choose ones that are in water or in their own fruit juice. Try to avoid the syrups because you would be avoiding the added sugars.
Okay, very important to know. And what about healthy snacks? Is that even available? Can you give us some examples?
Sure. The snacks can be a great option. You want to be careful not to snack in place of meals, especially empty calorie snacks like chips and candy for the most part. Like we mentioned, everything is included in a healthy lifestyle. You want to opt for more nourishing snacks that include a protein with a healthy fat or a carb. So some examples of that would be something like low-fat yogurt with berries, or peanut butter on toast or with an apple, air pop popcorn and nuts, hummus and vegetables, or crackers. Those are some good options. So again, try to choose those nourishing snacks most of the time. Every once in a while, enjoy your favorite foods, even if they're not the most nutrient dense.
Okay. And I think this is another big one, another big point among a lot of people today. How can we watch our portion size?
Absolutely. I will start with this. It's very hard to control your portions if you are very hungry. So make sure you're paying attention to your hunger and your fullness cues, and that you're eating a meal every 3 to 5 hours. Having snacks in between is needed, especially so that you don't get to that ravenous feeling, because then it's hard to not overdo it. But other tips to control portion sizes, don't eat from the container. Try to portion out your snacks ahead of time. You can use single serving snacks, or if you want to, for a more cost effective way, to purchase in bulk and then pre-portion your snacks yourself. You can use smaller plates and bowls to help with the portions. Review the serving sizes on the nutrition facts panel, see if that's really how much you want to eat and how much that serving amount looks like. Try to slow down between bites when you're eating, and then maybe wait 10 minutes after you're done eating before deciding if you want seconds. Lastly, you can follow the USDA My Plate portion recommendations. So you want to basically fill half of your plate with fruits and vegetables, a quarter of your plate starch like potatoes or rice, and the other quarter a lean protein like chicken, fish, or beans.
Okay. Thanks for that visual. I think that was a great way to better understand how to fix your plate in a healthier way and still enjoy the foods that you love. So thank you so much for that, Ashley. If you're just joining us, thank you so much for tuning in. Today, we're joined by two of our community health registered dietitians and a community health advocate to explore how food connects us, which is the theme for National Nutrition Month. We'll talk about all the powerful connections that we have with food, how we relate that to family connections. We'll also make a healthy smoothie with fresh and cultural ingredients and learn about the expanded Food RX program that's now available in 3 MedStar Health hospitals in the Baltimore region. So keep sticking around, share this broadcast with your friends on social, drop your comments below, your questions in the comment section below, and we'll keep going with some of our questions here. I want to turn to back to Angela. What are the benefits of preparing meals at home versus eating out?
You know, everyone loves a good night out, right, at a restaurant. But there is something about home prepared meals where you know what's in it. I think that's the biggest thing. You know how much salt you've added, you know how much fat you've added, and it's more geared to your personal taste, right? I tend to like a spicier meal. My husband is not a spice man. So when I make foods, if I'm making chickpea masala or something that has more of a East Indian influence, I tend to like a little spicier. Garam masala, the cardamom or the cumin. So I'm able to tailor my heat to me, because sometimes you go to a restaurant and they'll ask you spicy, mild, or medium, and sometimes it's still not quite hitting exactly your preference. It's also less expensive, right? So these days, a meal out is quite a treat. It can be expensive, but there are ways of making meals at home that are not only nutrient dense, delicious, but also really, really affordable. And so those are just 2 benefits of cooking home. The price, you're able to have possibly a meal left over for the next day. You can gear it towards your own specific taste preferences. And if you're really watching your sodium, and if you're really in the mindset of really wanting to take better care of your health through food, home cooking is always the best.
All right, great advice. And Angela, can you, speaking of, affordability, can you give us some tips on how to shop for healthy items on a budget?
Sure. So here we are, we're coming into the summer season, right? So here in Maryland, at least, we're coming into our prime growing season. Because of our climate, we get all 4 seasons. And so the winter and sometimes the late fall, we don't get much. But one of the benefits is we're coming into local. So whenever possible, whatever is local and in season at the moment is usually the least expensive. So, and when you're buying local, you're getting, that product right when it's at its most peak ripeness, highest in nutrient content. So those items tend to be a little bit more healthful. And a lot of times growers don't necessarily need to make their product fully organic, but if it's local, it's very, very close. Other things you can do to eat affordably is, fruits and vegetables. These days, we all know about eggs, but also, meats can be on the pricier side of your grocery list. So even if you incorporate just 1 or 2 days a week that are like meatless Monday or, tofu Tuesday, or, I'm trying to think of a word that goes with W. But if you can remove the higher cost portion of that meal, which is usually the meat, I think one of our dietitians at Franklin recently tried tofu tacos for her group, and I hear it was a success. Using sometimes the canned products like canned tuna, canned salmon. You can make really healthful salmon cakes and perhaps make a salad go with it, or even just using less. So sometimes if you wanted to use, maybe you wanted a burger, you could take half of the ground meat and then maybe use some pulverized mushrooms and maybe even some black beans as the other half of your pound. And if you mix that together, this is a way to stretch the ground beef for another day. And you're increasing your intake of vegetables in that burger. You're getting all the health properties of mushrooms, all the fiber of black beans, because we know ground beef has no fiber, right? And so it's a healthier burger. Put it on a whole wheat bun and, have a vegetable on the side, some lettuce and tomato. That's a relatively inexpensive meal, and it's also really healthy.
That's an excellent idea. I like those recipes. Giving me some ideas here.
Yeah.
Wale, what would be a good, a healthy and budget-friendly meal that you would prepare?
For me personally, I like to keep it simple.
My burger too fancy for you.
You said burger?
My burger's too fancy. The black beans, the mushroom.
It's not, but me, usually when I do cook at home, I like to keep it simple and quick. I like to keep it wildly friendly also. So a couple years ago, I usually used to buy my foods fresh. I used to get fresh protein, fresh meats, fresh beef, or whatever it may be, and then fresh vegetables also. Fast forward to 2025, I can't do that all the time. Foods are getting expensive. So I just like to utilize frozen vegetables, canned fruits, canned vegetables, whatever it may be. And I usually like to buy my carb sources in bulk, whether that's potatoes, pasta, or rice. And I keep it simple. I keep it rice, a random protein, and a random vegetable. But that's how I keep it. Wallet friendly. I utilize frozen vegetables and canned fruits.
And that's smart. That's a really good tip. It doesn't always have to be fresh. Frozen certainly lasts a lot longer and the nutrients are still there. So using frozen and also canned fruits, again, canned is not a bad thing. Just make sure that the fruit you're buying is in a natural juice, not in heavy syrup. It has about the same amount of carbohydrates as a piece of fresh fruit. So those are really good tips.
Okay, well, thank you both. Let's talk a little bit more about the Food RX programs that you manage. So Angela, could you share what is Food RX?
Sure. Food RX is a food as medicine program that was created by MedStar Health in 2021. The reason that the hospital, the health system wanted to do it was because we have patients who are living with chronic disease, such as diabetes, cardiovascular disease, some asthma, some lung-related conditions. And it often requires the patient to do quite a bit of self-management to make sure that they're not experiencing flares or complications associated with it. However, there were patients who were frequently presenting to the emergency on a fairly regular basis for pretty much the same thing. So what we decided to do is try to do a whole person, a whole patient approach, rather than just treating the issue at the moment when they present to the hospital. Let's look at the whole person's life. Let's look at where they live. Let's look at what they eat. Let's look at the medications that they take. Let's find out if they have a regular primary care provider, or if they have an endocrinologist or a cardiologist. Let's see if they have transportation to their appointments. All of these factors come into play when we're trying to determine how a patient can self-manage all these things that we tend to take for granted. When we have doctor's appointments, we get in our car and we go to the doctors and we don't really think too much about it. But there are a lot of steps in between that we need that have to happen in order for you to get from point A to point B. So FoodRx provides not only nutrition support for the patients, because also food insecurity, health equity, all of these factors have to be taken into account when we think about how can we best help the patient. So working with Wale, we really meet with the patient. Wale will screen the patient for any social needs. And if the patient meets some of the other criteria for FoodRx, whether it's an A1C greater than 7 or 8 and documented food security, or at least screening for food insecurity, they will receive nutrition support from the dietitians in each of the locations. They will receive fresh produce delivered to their home through one of our partners, Hungry Harvest. They have regular consults with RDs. We connect them with whatever specialist would be appropriate for that patient to make sure that they have continuity of care once they're completed the program in 6 months. And I think the most important thing is providing that education and providing the food support, providing the fresh fruits and vegetables, providing the lean, healthy proteins, the healthy olive oil, providing gym memberships to the YMCA, because it's not just food and it's not just medicine. It really is looking at our whole lifestyle and saying, how can we be more active? Maybe we need to drop a few pounds. Maybe that would help improve the medical condition. So FoodRx is a all-inclusive chronic care model that, in addition to nutrition support, provides excellent medical care and helps a person learn how to self-manage, how to take care of themselves.
That's fantastic. Could you tell us more about the FoodRx programs that are available in the Baltimore area?
Yeah, so I'm here at Good Sam. Wale and I work here at Good Samaritan Hospital in the Collaborative Care Program Clinic. It's an outpatient ambulatory clinic. We also have FoodRx at our outpatient endo center at Harbor Hospital, and that's where Ashley is the lead dietitian. We also have Franklin Square Hospital, the Family Medical Center, and the primary care practice. And our dietitian, Tonya Anderson Morgan, is the lead dietitian there. And then coming very soon, we will also be able to offer that location that sort of connects between Union and Good Samaritan Hospital, where we will be partnering with the Franciscan Center, who is one of our existing partners now, but we're going to deepen that partnership by launching a 4th FoodRx location that will coincide with our mobile health center that is there once a week on Mondays to work with their clientele, their population in that area, where they'll be able to see a provider on the mobile health unit. That provider can then make a referral to either the FoodRx at Franciscan, or if they need additional medical care, they can be referred to Good Sam.
That's
so we're
amazing.
growing.
That's
Yeah,
amazing. Yeah, that's great news.
Yeah.
All right, let's talk more about how food connects us. I want to turn to Ashley for this. How important is it for you to be able to offer dietary recommendations for your food RX patients who have different cultural backgrounds?
Yeah, so since what we eat is largely rooted in cultural beliefs and values, it's very important that I understand my patient's cultural background, including their traditional foods, their cooking methods, their eating patterns that are specific to their culture so that I can gain their trust and their respect. So that's important to have because with that, research shows that nutrition counseling that is culturally sensitive actually improves the patient's adherence and following these recommendations, and it leads to better health outcomes.
That's very important. And can you share some of the health benefits of adding flavor through foods and spices from other regions of the world?
Yeah, absolutely. So using fruit, such as dates and mangoes that we're actually going to look at, or some of the recipes that we have for the smoothies, is a great way to use as a sugar substitute. So the natural sugars that are in fruits are different from added sugars, which is what we want to limit. So the natural sugars in the fruit are also jam-packed with their fiber content, which we know it aids in digestion and it helps to lower cholesterol. It also has vitamins and minerals and other phytonutrients. So these all work synergistically in the whole fruit to provide positive improved health benefits. One example is the vitamin C in the mangoes can help us absorb the iron that's in the dates. Avocados are really rich in healthy fats and fiber as well. They are rich in vitamins K and E. And those fats in the avocados help us to absorb those fat-soluble vitamins. And then some of the spices that we'll be using in the recipes, including cocoa powder, cinnamon, and turmeric, they're all rich in antioxidants. So flavonoids is a type of antioxidant in cocoa powder that has been shown to protect the arteries of our blood vessels. Polyphenols in cinnamon have been shown to reduce inflammation, and they may help with insulin sensitivity, some studies have shown. And turmeric, that is, or actually curcumin is the active ingredient in turmeric. That's a powerful antioxidant, great for reducing inflammation as well. It aids in the metabolic syndrome and a lot more. But food and nutrition, they play a great role, a supportive role in our health, and they're meant to complement the medical treatments that providers make for us. So we should always prioritize the advice from our medical providers and healthcare team.
Absolutely. Thank you so much, Ashley. And thank you all for joining us again. Now, I understand we're going to tie all of this information together, all of this great advice, and make a healthy smoothie out of cultural ingredients. So, Angela, take it away.
Sure. So before we get started, I do want to say, so if anyone is listening and hears something that sparks their interest, or maybe you're even thinking, well, that's me, like I need this kind of help. I just want to give a little bit more clarity to someone who might meet the criteria. So at the two locations at Harbor and Franklin, diabetes is the only condition for which we see patients at those two locations. So A1C greater than 7 or 8, depending upon the location. You can have your provider refer you. Sometimes our patients will get referred post-hospital discharge. And we've even had, if you have a MedStar provider and you feel like this is you, like we're talking to you, you can also reach out to the specific clinic on your own and just request an appointment to be seen and assessed and to learn if you would be a good candidate or if you at least meet the criteria for Food RX. Our goal is really to help stop these complications that so many of our MedStar patients are having related to uncontrolled diabetes. Diabetes is one of the major chronic illnesses in the nation, and it has a huge impact on healthcare spending. 1 in every $4 spent in U.S. healthcare is spent on diabetes care. diabetes is also a bit of a complicated disease if you're not a clinician. So sometimes there's a lot to know. And what we are finding is that once patients are educated on diabetes and they understand why their blood sugar is getting high, why their blood sugar is getting low, the foods that really elevate blood sugar much more so than other carbohydrates. Once we sort of get the education piece together, patients start to see significant improvement, not just in their daily blood glucose management, but in that 3-month period where we recheck that A1C, we're able to see patients who have A1Cs 10 or 11 or 12%, really coming down into that goal, that target range of about 7 to 7.5. And that is where your risk of complications associated with uncontrolled diabetes kind of go away or at their lowest. So we really work to get a patient to a 7 or a 7.5 because we know that is that safe spot for them where they're able to continue to live a very long and healthy life and not really live with those complications like amputations and kidney disease and loss of good vision. There's so many really traumatic complications, and FoodRx is here to sort of step in that gap and say, it doesn't have to be this way. There's a better way, and that way is food is medicine.
That's great. That's great. All right.
So you're ready for the smoothie?
Yes. The
right,
moment
so-
we've all been waiting for you.
So do you want to tell the audience what we're making before, because I'm not sure I might get jumbled here.
Okay.
You
So
know.
I have we're going to make smoothie number 1 in the blender. I don't have the title for that, but I'm sure we'll add some of that information as well for viewers to follow along in
Okay.
case they'd like to make it themselves as well.
Okay, so today we have two smoothies that are not your typical. I think sometimes when we're home, we're not that creative. And I encourage everyone, when you're making food, to think to yourself, what else can I add that's going to make this even more healthy, right? Yes, my blueberries and my almond milk and my banana are healthy, but you could add soaked chia seeds, right? You can soak your chia seeds overnight. They are a complete protein in terms of amino acids, meaning they have all 9 essential amino acids. So you could add chia seeds. You'll see today where we're starting to add spices as we talk about cultural foods. But the first smoothie we already made, and this is more geared toward this is like a play on a Mexican smoothie. So it has, let's see, it's got coconut milk, it's got half of an avocado, 3 tablespoons of cacao powder, which is actually mentioned is a great antioxidant. Again, that avocado is going to give you that rich, silky, smooth texture. It's going to give you fiber, and it's going to give you healthy fat that's going to help keep you fuller longer. So again, when we're making food, or at least for me, when I'm eating food, I try to think, how can I put this plate together where I'm getting the biggest bang for my buck? What else do I have in my refrigerator that's really going to pack a nutrition punch for me? For sweetness, we added 2 dates, which is more of kind of a Middle Eastern sweetener, a natural sweetener. It also has fiber. And then we talked about heat. This has a little bit of cayenne pepper and a little bit of chili powder. So I am going to ask Wale for his honest opinion. I'm going to get you to try it. This is, again, it's got a little bit of a Mexican flair, and then we added ice to just sort of make it a little frothier. Let's give it a try.
I like it.
Is it spicy at all?
Not spicy. It has a chocolate type of taste to it. Oh, I could taste the spice now. Spice was delayed.
It's that slow burn, and it's got a little bit of cinnamon in it. So again, anti-inflammation. A lot of diseases and a lot of health ailments are kind of rooted in inflammation. And if we can reduce the inflammation in the body, we can generally improve overall status. So a lot of spices tend to have anti-inflammatory properties, which is, a little bit goes a long way. All right, so that's a Mexican. So we're taking a trip around the Mexican peninsula, but now The one that we're going to make is more of a Middle Eastern inspired smoothie, and it's got a couple of interesting ingredients in it. So I'm going to get Wale to help me out, and he's going to dump in the blender, and we'll talk about what we have going on. So first, I think we should start with a little bit of ice, because I think the colder the better. So let's maybe use half of that. Yeah. So a little bit of ice. Perfect. What's next?
Coconut water.
So this is almond milk. This is almond milk. So we can dump that in, sure. And you could use oat milk. You could use soy milk, whatever you like. Next, let's add, so this is going to be 1 cup of non-fat Greek yogurt. And again, if you like a coconut yogurt, you could also do that, but this is just plain. This is going to give you that satisfying fat. Well, actually, there's no fat in this, is there? You could use low fat, right? It doesn't necessarily have to be no fat. And if you're lactose intolerant, they also have plant-based yogurts, okay? And let's try this one. So this is an ingredient that most of you probably don't use, and this is rose water. Rose water is not only good for external use, it's a good facial tonic if you want to spritz it, but it also has anti-inflammatory properties as well. So we've got rose water.
Smells good.
It doesn't smell good?
The rose water smells great.
All right, next we've got 2 dates. And again, this Middle Eastern, again, for natural sweetness and a little bit of fiber. If you're using dried dates, I recommend that you soak your dates in warm water for about 20 minutes just to soften them up before you try to blend them. And we've got half of a banana. And last but not least, we have a little bit of turmeric. Whole thing. Perfect. So I think if we were to nickname this smoothie something, it would be the anti-inflammatory smoothie. But that's all the ingredients. All right, let's pulse this for a little bit. All right, let's see. Yep,
Okay, what would come to this one?
just stick both. All right. You hold, I'll pour. Good. And now I have not made this before, so this will be my first time trying. And then, last but not least, we're going to sprinkle on a little bit of crushed pistachio, just a little bit. Cheers to your health.
Mm-hmm.
It's light and refreshing.
Everybody.
Yeah, it's not heavy at all. Yeah, I like it. I like it.
Feel greedy eating in front of everybody.
I know. I'm like, where's my smoothie? So thank
Yeah,
you so much for that demonstration.
Yeah, it's delicious.
All right. So as we come to a close for our Facebook Live, I want to get some final thoughts from all of you about how food can connect us. So I'll start with you, Angela.
Yeah, you should enjoy your food, right? There's always food at gatherings. You know, sometimes that's the thing we're looking forward to the most, is that one dish that we have that's our favorite. But I would encourage everyone to try something new. Try a different restaurant. Try a Nigerian restaurant. Try going to a restaurant where instead of utensils, the other part of the food, the fufu, is the utensil. Just If you have a neighbor that is maybe of a different ethnicity, invite them over, like have a potluck and have them bring something to try from their culture, and you make something from your culture and share, because I feel that when we know more about each other, we find that we have more in common than we do not in common. And it just helps bring us together. Enjoy your food. Try to eat as healthy as your budget allows. And if you have in your area local cooking classes, or you can also find them online, try taking a cooking class. Learn a new skill. It might up your culinary game a little bit and make you feel a little bit more comfortable about trying something new.
All great ideas. Thank you so much, Angela. What about you, Wale?
I agree with a lot that Angela said. I think people should try new dishes. Also, educate yourself on different types of foods. A lot of times when people think of healthy eating, they think of bland, boring types of food, which that's not what healthy eating is. You can always, it's real easy to enjoy your food and also eat healthy at the same time. Also, a lot of times when I am screening patients, I find when we do talk about foods, I see that they start to open up more, and it's easier to communicate with them, and it's easier for me to help them. So yeah, I think people should just educate themselves on different types of foods, and there's a lot of foods out here to enjoy, and it's also easy to be healthy at the same time.
Great advice. And Ashley.
So absolutely, to try something new, especially those fruits and vegetables. I know most of us don't eat enough fiber, so that's always great. And then also that not everything we eat has to be because of the nutritional value. We don't, have to eat because something is healthy or not. We eat, as we mentioned, based on our culture and based on our tastes, based on our affordability, accessibility, what we have available. And speaking of, just connecting us in different cultures, the My Plate was kind of designed that we can tailor it to each of our unique cultures and the foods that are traditional to us. So by having, those fruits and vegetables, protein, starches, that's in every culture. So that is one way we can be mindful of our portions, what we're eating, still eat in a nutritious way tailored to our culture. And to just remember that, and not to judge other people for what they are eating, simply by remembering that we eat foods for many different reasons.
Very important points. Thank you so much. That's a wrap for our Facebook Live. We want to thank you all for tuning in and being a part of this important conversation about how food can connect us and how to eat healthy as well on a budget. Great information. A special thank you to Angela, Ashley, and Wale for sharing your expertise and insight with us today. Thanks for the smoothie demo. I learned a lot, definitely. We hope you found this discussion helpful and inspiring. For more information about our Food RX programs and locations, please check out the phone numbers that we'll share in the comment section as well. And thank you for joining us. We hope you have a healthy and happy connection with food. Have a great day.
Happy Nutrition Month.
Thank you all for joining.